Now, today we are going to discuss diet in patients who got acute viral hepatitis. We've got different type of acute viral hepatitis. It can be A, B, C, D, and E. And there are some rare type of viruses. They can also cause hepatitis, but generally these are the common one, and they present with yellowness of the eye. So we call this the common jaundice. In this, the hepatitis A and E are transmitted by fecal oral route, and they are related with nutrition. Now there are two aspects. One is the diets which should be avoided to prevent the hepatitis from occurring, and the second aspect is what to do if the patient has developed hepatitis, what sort of diet should be taken. So we are going to discuss the second portion of it, not the first portion of it. Now when the patients they develop jaundice, this disease or this acute hepatitis is a self-limiting illness. It does not require any treatment as such. No drugs are available to cure the acute hepatitis. It is self-limiting. It is cured by body's own defense mechanism, and there are a lot of drugs available in the market where the manufacturers claim that they may be useful in acute hepatitis, but to date we don't have any such drug which can treat these cases of acute viral hepatitis. Now, when a patient develops acute viral hepatitis, there are a lot of problems. There is a big confusion. The first thing which comes to patient's mind is what to eat and what not to eat. When we are planning the diet of these patients, again, two aspects should be kept in mind. The acute hepatitis is usually associated with a lot of nausea, anorexia, loss of appetite, loss of taste, and there is nausea, and patients they also vomit. So a diet which can increase nausea, keep in mind that should not be introduced into the patient's diet. And the second thing is that very tasteless and unpalatable diets should not be offered, because the patients already have distaste, they refuse to eat these foods. So the flavoring aspect or the taste aspect should be kept in mind. Now we see what to take and what not to take. So what to take of this, first thing is the liquids. Water is the best liquid which the patient should keep taking. This is plenty of water. It depends upon the ambient temperature and the patient's fever as well. So the water requirements are generally dependent on these two things, the external temperature and the internal body temperature. A simple guide to the water intake is that the patient should have adequate urine flow. The water should be taken in such an amount that there is an adequate urine flow. Some of the patients, because of the persistent vomiting and nausea, cannot take water. They may be offered intravenous hydration, but generally, majority of patients, intravenous hydration is not required. And only in those circumstances where a patient cannot tolerate even smaller amount of water in the form of sips, the patient may be offered intravenous hydration. Otherwise, small amounts of water taken frequently generally fulfills the patient's requirement of water. Then a lot of people say that fresh juices in patients who got acute hepatitis are very useful. This is just a misconception. Fresh juices of any fruits, they cannot be substitute for the water. They can be taken just for the purpose of bad taste. Otherwise, these juices do not have anything which can offer a patient with hepatitis any help in the treatment of the hepatitis. This may just be used for flavoring, and it cannot replace the water. So a large amount of fresh juices do not help any patient with acute hepatitis. Maybe a glass or so in a day may be enough and should not be taken. So it is not recommended as a substitute for water. And then milk, low fat milk can be taken by these patients, and this may provide some nutrition as well. So this may be used. And when we come to the solids, carbohydrates, generally complex carbohydrates should be used. Complex carbohydrates are the starches, like they are contained in the wheat, in the rice, or other forms of grains, so they can be used. There is no use really of using the soluble sugars in large quantities, because they tend to increase the weight of the patient and they do not help in combating the effects of hepatitis. So a large amount of these sugary drinks may not be very useful for these patients. So complex carbohydrates can be taken as the patient's stomach accepts. Then proteins, there was a lot of concept of protein restriction in the past, but I don't think there is any need for protein restriction in the current understanding of the diet of hepatitis. The protein can come from animal sources, that can come from vegetable sources. Patient can have fish, chicken, patient can have egg whites. The chicken should be actually without skin, so that contains a high fat content, so it should be without skin. Similarly, the patient can even take meats. The lean meats may be useful, and the protein can also come from plant sources. For example, lentils contain some of the protein. So patients should be provided sufficient amount of protein so that the body protein itself does not break down, because the immunological system requires the proteins which make the immunoglobulins, which themselves are proteins. They are synthesized from raw material of amino acids, which are provided again by protein. So if the protein intake is not sufficient, body's own protein will start breaking to provide those immunoglobulins. So protein restriction generally is not required. Then fats. The fats should be reduced because they cause a lot of nausea. So the fat content should be low. Butter and olive oil in small to moderate amounts can be used, but high fat content in patients who got acute viral hepatitis should be avoided because they produce a lot of nausea. So they may not be required. And the second thing is that for the digestion of the fats, we require bile salts, bile acids, which come from the liver. So if we take a lot of fat, that may cause problem and put a lot of load on the liver. So the fats should be reduced, but they can be taken. It's not recommended that patient be given bland fat-free diet. That is not going to be of any help. Then what not to take in the liquids: no alcoholic beverages, no drugs or medicines which can cause liver damage should be taken, they should be stopped. Carbonated beverages should be reduced, preferably should not be taken, and high fat milk products, they should also be avoided in drinking. And then large amounts of coffee and tea, they are not useful. They may produce acidity and nausea, so they may not be used. So these are the fluids which may be reduced in, some of them should altogether avoided in these patients, and some can be taken in really low amounts. Among the solids, the deep fried items which contain a lot of fat should be avoided. Foods with very high content of fat, they should be avoided. Large amount of proteins, if the patient is taking a too large amount of pure proteins, it may not be of any help. It may is not recommended, but sufficient amount of protein should be taken. So this is what should generally be recommended in patients who got hepatitis. So it's the nutrition which helps these patients in combating the disease. So we require plenty of water. The vitamins should be taken in the form of fresh fruits and vegetables. Intravenous vitamins are of no use. They are used by many physicians, but they are of no use. Sufficient amount of carbohydrates and proteins should be taken, and the fat should generally be reduced. So these are the general outline in patients who got acute viral hepatitis, and it is the good nutrition, proper amount of rest. It helps the patient in overcoming the acute viral hepatitis.